9 signs of low cortisol levels in busy professional women. So you've probably heard of high cortisol, you have stress, it spikes your cortisol, stress, cortisol is your stress hormone. But actually, I find that many women that I work with actually have low cortisol. Today, I'm giving you the signs and what to look for.
Welcome to She's Healthy, a podcast for ambitious women on their journey to become the healthiest version of themselves. I'm your host, Lori Aikman.
All right, welcome back to the She's Healthy podcast. If this is your first time watching, my name is Lori Aikman. I am a nurse practitioner. I'm the founder and CEO of Crown Executive Health, where we help busy professional women regain and sustain their energy so that they can just enjoy the life that they've worked so hard for without burning out. And we do that through a functional medicine approach to hormone management. So I do have to give you my medical disclaimer before I dive in. I am a nurse practitioner, but this podcast is for informational purposes only. So I always recommend that you just take this information with a grain of salt, but then go and consult your practitioner, your provider before you make any changes to your routine. All right. All right. So this ended up being not planned necessarily at first, but I'm calling this our cortisol series. So on the last episode, if you didn't watch it already, we talked about signs of high cortisol. So today I'm actually going to talk about low cortisol and how I actually see that in more women than I do the high cortisol. So, and then we're going to talk about, what do you do about it? How do you treat it? What are supplements that you should take if you do have a cortisol issue? How to test for it, things like that. So let's dive in. So I work with, again, in my practice, Crown Executive Health, I work with very high achieving women, busy women, women who are, have high demand jobs, or maybe have a high demand job and they're moms and they're raising kids, or they're caring for elderly parents. Just I think culturally, a lot of times as women, we're wearing a lot of hats. We have a lot of responsibilities. And especially if you are you're a go-getter, you're a high achiever, you're used to, let's be honest, you're used to over functioning, right? I say this as a over functioning, high achieving female myself. So I definitely am not saying this pointing any fingers, definitely pointing the finger at myself as well. But what we actually find, okay, so you've probably heard of, cortisol is your stress hormone, and maybe if you have belly weight gain, or you have, these other signs, maybe you have a cortisol issue. But I actually find in the testing, so I use a functional medicine approach, and we use a lot of functional lab testing with my patients and clients. What I find is that actually a lot of women have low cortisol. And that's actually their problem and not high cortisol. I actually have found I'm trying to think, maybe one woman that I can think of that had high cortisol levels. Otherwise, it's primarily been low, or even low normal range for them. And it's actually been more men when we've tested them that have had high cortisol levels. So, and again, I'm not going to dive in today. How do you test? What tests do you do? All that kind of stuff. We'll do that in another episode. So stay tuned. Subscribe if you haven't already so that you can see when we release those episodes. But part of this, I just want to give the background of, there's actually research that shows that women, just our bodies handle stress differently. And I think I spoke to a little bit already, there's that cultural component. There's that, women are often wearing, not that men aren't parenting, my husband parents our children as well, but I think women just kind of take on a more mental burden and emotional burden, more so than I don't mean to throw my husband under the bus, but it's just how our family functions. I worry about groceries and what we're going to eat and my business and, when are the doctor's appointments for the kids? And, I'm thinking of all those things where he's maybe more focused on, his career and things he wants to accomplish, things, he does a lot of the stuff around our house. My husband's very handy and hands-on. So he's thinking about, when's our next oil change for our vehicles, which, I don't think about that at all. But anyways, but there is research that shows how stress impacts women's bodies differently than men. And just we are more predisposed to burnout. We actually see in the data too. Sometimes I do genetic testing with my clients, and there's people who are genetically more predisposed to burnout. And so stressors are going to affect them differently. Also, we have to consider history of trauma. So if you're somebody who has had a history of trauma, and I'm not going to get into, there's all kinds of traumas, a big T trauma, little T trauma, but basically there's things sometimes that, especially if they've happened as a child, they impact the way our body responds to stress. So our nervous system, if we think about stress, what's happening is that fight or flight gets triggered. Our nervous system gets triggered by stressors. And if we are somebody who has not, maybe had a lot of things happening in an unstable environment or things like that growing up, you may be respond to stress differently than somebody who maybe had a more calm upbringing, things like that. Or if you there's all kinds of things that can happen. Sometimes when I've worked with, I can think of one client in particular. When we started our work together, we went through the last few years of her life, and she had lost a parent, she had lost a job, she became pregnant, just a lot of big life changes. And I think sometimes, because they're part of our life, they're just our normal, we don't consider how those impact our nervous system and the physiologic response, right? How our, like, the chemicals and the nervous system and all that stuff gets triggered in our body by the events in our life. Okay, so get off my soapbox there. I just had to give you that beginning part. So we're going to dive in. I'm going to give you 9 signs today that you have low cortisol. And number 1 is fatigue, right? I mean, I think this one, for me, it's obvious, but I think there's not a woman that I talk to. There's very few. Well, I shouldn't say that. Majority of the women that are coming to me for help are coming to me because they don't feel the way they want to feel in their body. I would say the majority of them tell me they have fatigue. They, get a full night's rest, but they still feel tired. They can't get through the day without feeling like they need to take a nap. Or maybe they just don't have, I have some energy I can do, right? Especially if you're a high achieving, over functioning female, you can get through your day, but you'd like to have more energy than you do. And what we have to think about is, so we have a normal, so we can't think of cortisol as just a bad thing. Oh, it's just stress. We actually have normal amounts of cortisol throughout the day. So we have, as we wake up in the morning, we have some cortisol. About 30 minutes after we wake up, our cortisol should rise and peak. And then our cortisol should slowly decline throughout the day till, of course, at night, when we want to go to bed, we want cortisol to be low. Okay. So if you think about, I see this a lot. I see where women don't have an increase at all. Their cortisol runs low, low, low all day long, and they just feel tired. They have a hard time getting out of bed. They feel like maybe it might even be, oh, I'm just not motivated, or it's my fault, or I'm depressed, or things like that. But it actually can be a cortisol issue. So if you're struggling with fatigue, just consider that in your mind. So another one of low cortisol levels is, this might sound weird, but you can have trouble sleeping. So sometimes when we have low cortisol levels, it can also affect our melatonin levels. And so this is a really tough place to be if you're like, I can't sleep at night. So I'm exhausted when I wake up in the morning. I have no energy to make it through the day, but then when I need to sleep, I can't sleep, right? And what has happened is your nervous system has gotten so dysregulated, your cortisol levels are off. It's also thrown off your other neurotransmitters and hormones and things in your body. And so you may be struggling with low melatonin and poor sleep. Another one, this is we talk if you didn't catch the first video or first episode, we did talk about this one, but you can have sugar cravings or snacking or things like that. And we've got to think about this isn't again just a willpower issue. This can be so one of the things cortisol does is, and it's a protective thing for our body, is that cortisol brings our blood sugar up. So that we have, think about when cortisol is getting released, it's when our nervous system is triggered. It's often when we are in fight or flight. And so when cortisol is going to cause that release of blood sugar, release of stored blood sugar. So it brings your blood sugar levels up so that you have the energy to get through the day, so that you are, into if you're in a stressful situation, so that you can fight or flee from the situation. So if you've got really low cortisol levels, you can actually have lower blood sugar levels. These cravings can be like your body's just like, I'm trying to keep things, a lot of times if you ever learned, you took a biology class and you learned about homeostasis, right? Our body's always trying to get back to normal, right? I need to get that blood sugar back up in normal range. So I'm having these cravings so that I trigger, your chemicals trigger you to eat so that you bring your blood sugar up. Okay. Another one, and I see this in clients, I see this in my patients. You can have low mood, depression, seasonal affective disorder, things like that. And what we have to think about is when you do have low cortisol, you don't just have low cortisol. So cortisol is produced by the adrenal glands. The adrenal glands also produce a bunch of other hormones and neurotransmitters. And what I see a lot of times in my patients is that there's some markers on the particular test that I like to use that show the brain chemicals, show our levels of neurotransmitters. And a lot of times, people have, in particular, low dopamine levels, we see. And so you can kind of lack motivation, you can lack energy, lack feeling, a lot of times people just kind of feel like, especially if they're a mom. One of my clients today was saying, now that we've got her on her journey and we're restoring her hormones, she's like, I actually, did bedtime with my kids and we read stories and I just haven't had the desire, the motivation and stuff before. And again, I keep bringing these things up because I think sometimes we can guilt and shame ourselves so much if we have symptoms like these, that it's just a willpower. It's just I'm not doing enough, but it can really be a chemical problem, a hormonal problem that is causing you to feel the way you feel. Okay. All right. Then number 5. So you can have low blood pressure. So this one is going to go hand in hand with the last one. Again, when we have low cortisol levels, we have low output from the adrenal glands, which can some chemicals that are produced, catecholamines are what they're called, by the adrenal glands are norepinephrine and epinephrine. You might think of these as adrenaline and noradrenaline. This always reminds me of my ICU days. Those are actually things we give to people in the IV to keep their blood pressure and their heart rate up. So if your adrenals are really depleted, you've got low cortisol levels, you're likely going to have low output of epinephrine and norepinephrine. And what I see a lot of times in my clients is they'll tell me, when I get up in the morning, I feel dizzy. So any kind of moving from lying down, going from lying down to getting up, from sitting to standing, they maybe feel, we would call that postural or orthostatic hypotension. It just means when you're changing positions like that, your body's having a hard time keeping your blood pressure up, so you can feel like a little woozy and a little dizzy. And that is a sign that those chemicals are depleted. And so if you do have that, I will tell you one thing that can be really, I know we're not doing this today, but one thing that can be really helpful is just making sure you're getting high quality electrolytes in. So you're drinking, when I get up in the morning, I have like a 24-ounce bottle of water, and I usually put a scoop of electrolytes in there and drink that whole thing with the electrolytes. So some popular brands out there are that LMNT. I love Relight from Redmond's sea salt. So that's not sponsored. I don't get any commission from them. Those are just things I really like to use. Okay. Along with this, again, number 6 is you can have a low body temperature, a decreased body temperature. And what's going on there is when we have decreased cortisol, well, that's coming from decreased adrenal function, and then our adrenal function can then affect our thyroid function. And so what we can see is that a lot of times, again, the women that I work with have a lower basal body temperature. So if you're somebody who's maybe you are, you're doing the natural family planning, or you're in TTC, you're trying to conceive and you're tracking things like that. If you notice that you have a low basal body temperature, right, that can be a sign that it's really, and if you're totally going off my script here, but if you're struggling with fertility and you're seeing that's a problem, I see this a lot in my clients where fertility is actually coming from an adrenal and an HPA axis problem that's depleting your sex hormones. But the sign that we're talking about here is lower basal body temperature. So some other ways that you could track that, if you have the Aura ring, it's like, it's an activity tracker. It tracks sleep, tracks heart rate, steps, all that kind of stuff. It does track your basal body temperature. If you are somebody who hasn't tracked basal body temperature before, basically you're going to want to track. So every day in the morning before you get out of bed, you do your temperature. And the difference is, like, your normal thermometer is going to have like 98.6. Well, a basal body temperature is going to give you the 100th. So it's going to be like 98.62 or 98.64, right? There's going to be 4, or I guess 5, you had a fever, 5 digits, right? Where you're going to have 2 digits past the decimal point, if that makes sense. I hope I'm explaining this right. Okay. Number 7. How are we doing? 16 minutes in. Okay. Number 7, you can have allergies and sensitivities. I see this so much. It's going to kind of tie into number 8, but I see this so much where people are having like just very, so think about, okay, so when your cortisol is low, your nervous system has gotten dysregulated, that HPA axis is off. It does affect your immune system. So you actually can set you up for going, again, I'm trying to stay on track here, but I'm like, this can set you up for development of autoimmune diseases. But what I see a lot of times is a lot of sensitivities. So this could be, I had one client in particular, she was literally having anaphylaxis, like had been to the hospital, had to have an EpiPen, and she just was reacting to so much. She couldn't even tell, what it was because of this nervous system dysregulation. And then basically your body's very inflamed, and your immune system is very triggered, and it's your defenses are lowered, and so your body is just going, okay, I'm just going to respond to everything. Like that might hurt me, that might be a foreign invader. So you can notice, I see this a ton in women after they've had babies and they're working and they're momming and raising kids, like food sensitivities that they didn't used to have. The same thing happened for me. It was worse after my second child, where I can't handle grains anymore like I used to. So literally corn, soy, wheat, it's a pain in the butt. But what's going on is that the low cortisol, right, is a symptom of dysregulation of all that nervous system, HPA axis, and then that is affecting your immune system. And so your body is now very reactive to a lot of different things. This can also show up as number 8 is more digestive issues. So again, that this can show up, again, the food sensitivities. Okay. So like, I just can't eat anything anymore without bloating and gas and diarrhea or constipation or reflux, whatever it is. Whereas those were foods you could tolerate in the past. But this can also be in the, what's going on is that, again, the adrenals, that HPA axis also regulates your immune system. your immunity is lowered, and I see this a ton when we do gut testing. Your immunity is lowered, so your basically your defenses are down on your gut, which can allow bacterial overgrowth and yeast overgrowth or viral infections in the gut, and so you can have a IBS symptoms. Again, that heartburn, indigestion, bloating, reflux, diarrhea, constipation, all any of those symptoms can be from low cortisol affecting that immune system and then allowing the, dysregulation or the good and bad bacteria to get out of balance. Okay? And then oh, I'm sorry. I only have 8 for you. I had low body temperature written down twice. So there, I'll have to change the title of this. So really 8 signs of low cortisol. And I kind of gave you guys a little bit more just talking about, all the different things that can happen. So if you're listening to this, you're hearing this and you're like, holy cow, this is so many of, I literally have all these symptoms, or you're having a lot of them and you're curious about, so the bread and butter of what I do is we do functional lab testing at Crown Executive Health. So we're looking at, rather than guessing what's going on in your body, we're just going right to the test, checking your cortisol levels, and then correcting things from there. And I will tell you, you've got to regulate your nervous system. You've got to balance out those adrenal hormones for digestive healing, for sex hormone healing. That's like the basis there.